EHR. I am looking at my patient Dolly Parton. She's a female, date of birth 4/10/1985. She's allergic to latex. Looks like Dolly presented to the ER 2 hours ago with acute urinary retention. So I'm gonna go to my orders. Looks like I have an order to insert an indwelling urinary catheter right now. Just gonna this. See again why we're inserting this. So it looks like she's been having abdominal and bladder pain, and she's been unable to urinate for 12 hours. All right, so I'm gonna gather my supplies for a catheter. Okay, so I'm gonna be performing pericare, so I'll make sure I have stuff for that. I'm gonna gather my Foley. This is a 12 French. It is latex free and it is not expired and intact. I'm gonna grab an extra pair of sterile gloves, some sterile lubricant, and my tape. And I think that's all I'm gonna need. Knock, knock.
Hello.
Hi, my name is Lainey. I'm gonna be your student nurse.
Hi.
By privacy. Make sure that the bed's locked. Could you verify for me your name and date of birth?
Yeah, it's Dolly Parton, 4/10/85.
All right, and Mrs. Parton, do you have any allergies?
Yeah, latex.
Okay, so do you have any other sensitivities to betadine or adhesives?
No?
Okay, so I am here because of the urinary retention that you're having. I have an order to insert an indwelling catheter. Have you had a catheter before?
Yeah.
Yeah. And on a scale of 0 to 10, with 10 being the worst pain you've ever felt, could you tell me how your abdomen's feeling right now?
About a 6.
Okay. So before I insert this catheter, I'm going to do some pericare and do a GI and GU assessment. I'm going to have to uncover you for that. Is that going to be okay?
Yes.
Okay. So I'm going to get my pericare stuff ready. Those gloves. Alright, I'm just going to expose you a bit. So first I would just inspect, making sure I don't see any swelling, bruising, lesions, abnormal discharge or foul odors, and everything looks okay. Look for landmarks, and then I'm just going to lightly palpate. Are you feeling any tenderness?
Yeah, a little bit.
Okay, so I note the tenderness and bladder distension. Okay, and then I'm going to perform pericare. Put that in the laundry. Make sure she's dry. Okay, so I'm gonna put these in the laundry. Kate, is it okay if I position your legs?
Yeah.
All right. So I'm gonna put her legs as far apart as is able for her. Okay. So is it okay if I leave you exposed while I set up my area?
Yeah.
Okay. Make sure I have the trash in here. And sanitize after pericare. And set up my tape. So have you had a urinary catheter before?
Yeah.
Yeah. It should help significantly with that abdominal pain from the urinary retention. But it might be just a little uncomfortable when we place it. I'll try to be as gentle and smooth as I can.
Okay.
Okay, everything I have again is latex free, not expired, and intact. So I'm going to open everything, make sure my sterile lube somewhere where it can't be contaminated. These are my extra gloves I'll set there. Alright. Take this out. Make sure that this is somewhere I'm not going to turn my back to it. gonna open away from me. Making sure I'm only touching the 1-inch borders. Take my sterile gloves. Put my waterproof pad under the patient. Okay. This can go in the trash. Alright, so now I'm able to do my sterile gloves. I don't touch my other sterile field. I'm only touching the 1-inch border. I'm gonna grab the cuff of this glove. Okay. And I'm gonna go under the cuff of this glove. On. Okay, so now that I have my sterile gloves on, I can readjust. This. And I'm again going to set up my sterile field. So when I do this, I'm just going to have you hold as still as possible. That way we don't contaminate anything.
Okay.
Make sure that my gloves are good. Take this out. Take off the sheath. Let me put my alcohol swabs in. And I'm going to grab my sterile lube. Set this here. Okay. Hook this up to my bulb. Okay, so I think I'm ready to begin. Are you ready?
Yep.
Okay, I'm gonna move this, making sure I don't touch my patient's legs. I'm gonna insert this way. All right, so now I'm gonna remove this hand from the sterile field to clean. So I'm gonna spread the labias, and I'm gonna start on the outside, drop, outside, drop, and then down the middle, drop. I'm gonna lubricate the tip, 2 to 3 inches. And then I'm gonna insert in a smooth fashion. Are you doing okay?
Yep.
This mannequin's a little tricky. Heck. There we go, maybe. Making sure I don't touch the outside at all. Could I have my assistant lay the head of the bed down just slightly? Maybe that'll... See if this will go in a little easier. Maybe up. Okay, there we go. Alright, are you doing okay?
Yep.
Alright, so I'd go till I got a flash of urine and then another 2 inches. Again, this mannequin's a little tricky, so right there we should have a flash of urine. We're almost to the bifurcation, so now I'm going to secure with this hand and inflate my balloon. Maybe. This hand is still sterile. Fortunately, this mannequin just is a little tricky. Okay. Okay, so once the balloon's inflated, disconnect that, and then I can pull back until I get resistance. Okay. All right, so now I am done with the sterile procedure, and I can remove my gloves, secure, and clean up my area. Okay, hand sanitize and put on some clean gloves. Are you doing okay?
Yeah.
All right. And secure this to the patient's leg. All right, I'm gonna put your leg back down a little bit just so I can secure this. Making sure that it's able to move if she's walking around or moves her legs at all. Okay. Clean this up and secure the bag. Okay, hang this below the level of the bladder on a non-movable area. Okay, I'm just gonna clean up right here and then do a little bit of pericare. Is that okay?
Okay, yeah.
Get rid of all this. Make sure I have my pericare, and I'm gonna change my gloves again. Okay, again, while I'm doing pericare, I'm always just assessing, making sure that this isn't rubbing or causing any injuries. So with your catheter, we're gonna just wanna make sure that you're aware and careful. Dispose of these, put that away. If you need to use the restroom or get up for any reason, just use your call light, let us know, and we can help you get to the restroom to make sure that you don't pull on the cord or trip on it.
Okay.
I'm gonna get you back to being comfortable. Here's your call light. Okay, I'm just gonna clean up my area just a little bit more, and then I will be out of your hair. Make sure I dispose of all that is facility requirements. Make sure her bed's locked, and I'm gonna lower it. Undo my privacy.
It like moved back up.
Oh.
That was weird.
Okay. All right. Dolly, again, if you have any issues, any burning, stabbing pain, anything like that, please just use your call light and let us know.
Okay.
All right. Thank you.
Thanks.